So you spoke a little bit about gut microbiome, and with that, it just reminds me so much of how personalized medicine is starting to get. Tell me a little bit about the impact of gut microbiome on susceptibility to obesity.
Yeah, we actually find that there was a couple of different studies that looked at the gut microbiome of people who were overweight or obese versus maintaining a healthy normal weight, and the flora is completely different. There's certain strains of lactobacillus that are higher in people who have a normal or healthy weight, and others that are lower. So it's like the ratio and the makeup is somewhat different between people who have overweight and obesity and people who are normal, such that they have even considered transplanting like stool or gut flora from normal or healthy patients into patients who suffer from overweight or obesity. But that's kind of extreme, but it's about supporting healthy factors. So things that would support a healthy gut microbiome are your fiber, watching out for inflammatory foods like dairy and excess sugar, and those sorts of things that support a healthy gut flora in general and are also good for your overall health. But we do definitely see stark differences between the microbiome makeup of someone who has a normal BMI and someone who suffers with overweight and obesity.
Yeah, and just for people who are going to be listening audio only, we're saying normal in air quotes. So, let's talk a little bit about genetics. With this conversation about gut microbiome, too, I'm starting to kind of think about the fact that there's a lot of comorbidities as well that are associated with obesity. I want to talk about those comorbidities, but also about how medication and treatment might impact gut microbiome as well. So let's talk about a little bit of the comorbidities that you see impacting obesity or that are associated with obesity and overweight the most. And is there generally a which comes first kind of type of relationship?
So obesity and overweight increase your risk of various comorbidities from head to toe. So we know that people who suffer from overweight or obesity have higher rates of anxiety, depression. It can also increase your risk of developing dementia in older age. We know the cardiovascular disease risk as well. So type 2 diabetes, high cholesterol, high blood pressure, heart failure. Also, I think people are surprised to know that overweight and obesity are, I think, the second highest risk factor for a bunch of different cancers as well. So breast cancer, it's the highest risk factor for recurrence of breast cancer as well. Renal cell carcinoma, which is a type of kidney cancer, stomach cancer. So literally overweight and obesity affect every single organ system from head to toe. I know we mostly harp on the cardiovascular risks, but it really affects a lot of different things, including cancer risk. And that's something that we are talking about more and more because we're seeing a higher incidence of cancer, even in younger age groups. So targeting and managing overweight and obesity has a lot of implications for various parts of health.